Hi, good afternoon. My name is Shannon Casebeer, and I am currently a director of nursing at A Helping Heart and Hand. We're a home health company. We work a lot with our veterans, keeping them in the home and independent. I am also a clinical adjunct professor at Florida State College of Jacksonville in the nursing program. It is my alma mater, so I did graduate from Florida State College of Jacksonville in 2018 with my ADN, and went on and graduated in December of 21 from the University of North Florida with my Bachelor's of Science in nursing. And I'm currently enrolled in the FNP program, like we all are, to become a family nurse practitioner. So that's the next step that I'm looking at. I do have experience with evidence-based practice and research. I was taking over as a director of electric convulsive therapy, which is ECT for short. It is an outpatient psych procedure. Yes, we still do ECT, and I know there's a lot of stigma around it. So if you have any questions, please feel free to reach out to me, because I really, truly believe in ECT for the correct patient, and I would love to talk to you about it, because I know there's a lot of stigma around it. So I'm always out educating on ECT, because I always get asked that question by fellow nurses is, do we really still do it? Yes, we do. It is different than it was, but we do still do it. But one of the things that came up when I took over as director is that we had a new psychiatrist come in. So he had a way of doing things, and our old psychiatrist had a way of doing things, and they disagreed. And it became very hard when you have two different standards that you have to meet based on which psychiatrist is working that day, because we did do procedures 3 days a week. So wanting to find out what was best for our patients and how we could make this consistent for our nurses, I decided to use that as my peacock question in my class. So I did go through all of those processes in my class and researched it and found the what they recommended, the American Psychiatry Association and the American Nurses Psychiatry Association. And so I was able to take that information, and I went through class, and I was learning about evidence-based practice and how to actually disseminate it and put it into practice. And I was presented it to the medical board there at River Point when I was finished with it and tweaked it. So they actually accepted it, and we changed policy. So we did change policy to do 1 minute of hyperventilation prior to the electrical stimulus and ECT when not contraindicated. So contraindications for that would be COPD or pregnancy, but pregnancy doesn't apply so much to our patient population, because we did not do pregnant mothers, because they have to be monitored by fetal monitors when they're having ECT, so that we can monitor baby as well as the patient. So they're usually referred out to an acute care facility here in town. So that's not one that we did normally. But I was able to get that policy changed, and then I took that and submitted my abstract later on to the Sigma Research Symposium, and I was actually a poster presentation that I gave there. I am a board member of Sigma here in town, so we are an at-large chapter that encompasses both the Jacksonville University and the University of North Florida here in town. So I'm actively on the board and currently working with our current research symposium that we'll be putting on in February. And so I will be presenting a couple of posters there. Most of my research now revolves around, if you've been in class with me, you've seen that a lot of it revolves around elder care. I do work in home health, and I do have Vietnam-era veterans, and they usually suffer from one of what I call, my own phrase, the trifecta or more, one or more, but it's usually diabetes, type 2, Parkinson's, and dementia. So I am very interested in what we can do to help keep those patients independent and at home, which is the goal and the mission of our company here. So I am responsible for overseeing all of our patients and all of the education needed for our aides. I'm the only nurse on staff at this particular company, because we are unlicensed home health. As far as the kind of care we don't give skilled nursing. So I kind of oversee everything that they do, and I'm responsible for their education, and we also teach CPR to the community here, as you can see behind me. So I have experience with research as well in my undergrad prior to nursing, because my undergrad was community health based. So I did a lot of research, took a lot of research classes, and worked on putting together programs to put out in the community. I know that some of them centered around cervical cancer in African American women, and other topics like that. We did SIDS for one of the projects that we did and presented here in town. So I have worked with it. My goals for this class is really just to continue to continue to increase my skill. I think that research and evidence-based practice is such a thick content area, and there is a lot to understand, and it can be overwhelming sometimes. I know in the beginning it was extremely overwhelming because I would read a research article and still have no idea what they were even talking about sometimes. I had a bad habit early on in my undergrad before taking my research class of just like reading the abstract and the conclusion, because everything in the middle just didn't make any sense to me. But it is something that takes a lot of practice, and I think anytime we have a chance to practice, it helps us grow our skills and become better at it as we move through our careers. So that's kind of my goal for this class. And then some personal things about me: I love to be outside. I get one day off a week. I make sure I get that day off. I'm very adamant about it, and that is my day to get outside. I am very, very lucky to live in Florida, so pretty much 365 days out of the year, I can be outside doing something. We don't get very cold. I know we're all up in arms right now and wearing our parkas because we got to 50 degrees, but based on the rest of the country, we're not really that cold. So I usually hike, kayak, or ride my bike. Those are my favorite things to do. I have hiked the AT trail from Amicola Falls up to the summit where it begins on Sumner Mountain, and all the way to about 3 days north of Harpers Ferry, Virginia, in sections, not all at one time. My goal is to eventually finish the trail and summit in Maine. However, that's on hold for a little bit because with working 2 jobs and being a student and then going into our clinicals next year, we're probably not going to be making it to the trail anytime soon, but I do get out to the local trails here. Very blessed to live in a town where I have kayaking trails galore, hiking trails galore. I am very lucky to live in a part of town where I actually have a bike trail that's off the main road that will take me pretty much anywhere I need to get. So it's nice to be able to ride my bike safely and not have to worry about traffic. So I get out as much as I can. That's kind of my space to regroup. But that's a little bit about me and my experience. I look forward to working with all of you in this class. And if you have any questions, reach out. Thank you.